Here we are, Travels with Dottie, and it's the 4th of November. I've done, this is the second video I've done today, and I am headed to the chiropractor. Including this one, I only have 4 sessions left before I go to quartzsite. And I feel okay. I don't have the intense pain that I had over a year ago, but I'm not feeling as good as I had hoped. So I guess the worst case is in the middle of the season I may have to pack up and come back here for a couple of weeks to get more treatments. You know, it looks more and more like there's a hip replacement in my future, but it certainly cannot happen financially before February, because that's when I start getting Medicare, and it's not going to happen the day I get Medicare because it's a process of examination and evaluation and recommendation. But I hope to see a doctor in March as soon as I get back here. See a specialist in hips and arthritis and hip replacement, and see if I'm going to be a viable candidate and what it'll take and all that kind of stuff. But I tell you, the chiropractor, the med spine here has been has taken me from a place where I was not able to sleep because of the pain and not able to get around without a cane. Now I don't need a cane, and the indication that everything isn't totally great is people that see me walk go, "Why, it looks like you're in pain." And I'm not in that much pain. It's just very, very stiff. And again, I got to, it's like I'm a broken record apologizing for when I turn into the sun on this camera, it washes out the view of me driving, and there's not a lot I can do about that. Sorry. It's just kind of the way it is. So that's what's on my mind this morning. Boy, Dottie also shares my affliction. Dottie is officially diagnosed as of yesterday with osteoarthritis. And she's 9.5. So 9.5 times 7 is going to be 66, and Dad's about to turn 65. So Dottie and I, at least temporarily, are pretty much the same age, and got kind of very similar things happening to us. So that's pretty interesting. But she, I give her medication I got for her yesterday, and boy, did she bounce back. She looked great on the walk this morning. I don't know if you've seen that video yet, but I did a DJI Neo selfie camera view of our walk, and she's got a little bit more pep in her step. I'd say a lot more pep in her step. It may be hard to detect from video to video, but boy, I noticed it. It was pretty remarkable. So I'm very happy for Dottie. Hopefully a hip replacement will do the same for me. It's kind of scary saying that out loud, hip replacement, because it's a surgery and it's going to take recovery, and it's kind of a big deal. But at least now that I'm getting Medicare and I'm getting the Part G supplement, I won't be worried about the financial aspects. Because if you don't have good insurance, like, I've had the Affordable Care Act, which I have viewed as, catastrophic insurance, like an $8,000 or $9,000 deductible, and certainly a surgery like that would be would eat up the deductible. So at minimum, I'd be shelling out, close to $10,000. Plus, I haven't read the fine print. There's probably other co-insurance fees and things like that they get you on even after the deductible is satisfied. I don't know that for sure, but it wouldn't surprise me. But with my Medicare and Part G intact, while it's not cheap per month, the max out-of-pocket's $221 for each year. The other thing that can happen with, you have an annual deductible of $8,000 or $9,000, a surgery could easily spill into the next year, right? And if that happens, then your deductible, everything resets. So your deductible of $8,000 becomes $16,000 if you're unlucky in timing. You don't always have a lot of choice on timing with surgery. All right, I'm at the chiropractor. I'll tell you how it went on the way back. All right, well, I am out of the chiropractors, and if you've not been with me before on this, here's what I think is, there's like 3 unique things about my chiropractor experience here. One is that, most chiropractors have a methodology, and this one's one of the more interesting that I've experienced. He has obviously a very expensive adjustment table that's, if you look at the table, it's broken up into sections, and it allows him to really focus the adjustments on very particular areas of your body. And I think that's pretty neat. So the adjustments don't take too long. By the time he knows you and knows your areas, he knows exactly what to adjust. And I would say it's certainly less than 5 minutes for the adjustment. But even before I go into there, I meet with a nurse practitioner. And if you're not familiar with a nurse practitioner, it's an advanced nurse that is so advanced that they can write prescriptions they usually work under a doctor. So, and they can do physical exams and diagnosis, and they can do pretty much stuff that doctors can do as long as they are working under a licensed medical doctor. So I get to meet with a nurse practitioner every single time. She does my vital signs, and it's a great resource to talk about medical things, get advice, talk about maybe other things that are going on with me medically, right? So it's really a great resource. So I go from there to do the adjustments, and you'd think it's over. No, it's not over. I go from there to the physical therapy room, and the chiropractor assigns 3 exercises per session. And I go, and it's like a little gym, and I go in there and do there's usually 2 people in there, 2 physical therapists, and they go through the exercises with me, and then I leave. And that's, I'm paying cash for this because of my, terrible insurance. I need to remind myself, well, that wasn't a good idea. We have a traffic stop here that I need to get over for. State trooper. Now that was a terrible move. That guy in front of me just switched into that lane right next to that state trooper. He's lucky that trooper doesn't get in the car and pull him over and give him a ticket. And here's that guy changing lanes again. So I've lost my train of thought. So it's only $50 paying out of pocket. $50 a session. And when I'm starting next, when I come back for my stint in the spring here, I'll be on Medicare with my Part G, and it will be 0 Medicare because my diagnosis is a spinal subluxation. That's covered for chiropractic under Medicare, and I will not have any kind of copay, and it will be, I hesitate to say free because I am paying a big extra premium. It's like $180. Everybody pays, if you don't know this, when you qualify for Medicare in this country at 65, you pay, starting this year in 2025, $185 a month. Boom. That's just to get onto the very basic, they call it Part A and Part B of Medicare. And you would hope that, and I did before I got educated, that would be it. That's all I'm going to pay, and everything's going to be covered, and I'll never write a check or have to pay a doctor. Well, that's just simply not true. Many things are only covered at like 80%. There's a thing called co-insurance, so you can pay a lot out of pocket if you stop there. Now, a lot of people get what they call advantage plans, and that's where the government basically sells your coverage to an insurance company, and the insurance company takes over all your Medicare. And a lot of them will say, it's free, you can join it for free. And it's like, wow, what a deal, that's free. I wonder why it doesn't cost me anything. It seems like a miracle. Well, I'll tell you right now why it doesn't cost anything. It's because they make money by taking a fee, and I don't even know what that fee is. I don't even know if you can find out what it is, but I can guarantee it's thousands of dollars per year that they pay the insurance company. They say, let's just wildly guess and say it's $5,000 a year. So they give XYZ insurance company $5,000 to cover you for a year. And then you become responsible for paying claims and doing all the stuff that the federal government generally does. But you have flexibility as that insurance company to come up with some rules about claims. And they can deny claims. They can make you see a specialist. They can make you stay in network. In other words, they become your health decision maker in a lot of cases and not your doctor. So I wanted nothing to do with that, but I wanted to be covered. So the other thing you can do is get what they call a Medicare supplement plan, and there are a bunch of them. The one I am is kind of the Cadillac version and the most expensive, and that's going to cost me about, I think it's $135 a month more. And other than medications, this plan covers everything with the exception of $221 deductible per year. Now I can pay $221 standing on one hand with my eyes closed. That's not right. So essentially everything's covered, except for, and here's kind of a clinker. When you get one of those advantage plans I talked to, they usually include some form of drug coverage. Well, if you get a supplement plan, you have to buy a third policy. Oh, and by the way, the supplement plan, it is administered by an insurance company, like there'll be a Plan G by United Healthcare, but the difference is all they're paid a lot less. They're paid to do the administration. They don't get to make decisions on referrals or whether or not something gets approved. That's still, everything goes through Medicare. So that's the big reason I spend the extra money to do that. So it's $135 a month versus essentially free, right? And there's a good reason for that. And then I have to go get a separate policy. And you can get inexpensive drug policies, but a lot depends on if you already have a drug you're taking. Medicare has a little program on their site where you input what drugs you're taking, how often, and what the prescription is, the drug and the dosage. And it will tell you for every plan that's listed out there how much this is really going to cost you, adding together the premiums and the copay for the drug. So my best plan, because I take an injectable diabetes medication, not insulin, but for type 2 diabetes, the retail price on the drug is over $1,000 a month. Therefore, I'm ending up with a $89 per month drug thing. So you take the $135 plus the $89 plus the $185, and we're in the neighborhood of, you know, $400 some odd dollars a month for my insurance. But basically, and I do a little bit of for that drug, I'm going to do a little bit of out of pocket. I think it's going to be, I can't remember exactly, like $20 or $30 a month. But it can be a complicated process. And I know I've talked about this several times, and I'm not here to give you advice on Medicare, Medicaid. I'm here to just tell you what my beliefs are about the system and what I believe that I've learned going through and figuring this stuff out. And I haven't pulled the trigger yet. I need to get in there. This was the first month I could do it, because it takes effect in February 1st. I need to get with my broker here in Pahrump, and we'll see if I can make that happen this week. It'd be great if I could make it happen today. It'd be wonderful. So anyway, here, the scene that you see is you're looking at the mountains out there, and on the right is I don't know if you can see it, is I'm trying to see if Mount Charleston is visible to you. It's off on the right there. But anyway, that mountain range. The other side of that mountain range, of course, is Las Vegas. And I mean, you'd have to go over the mountain range in a little bear right, and it'd be in Las Vegas. But the other side of the mountain range is certainly, you're in Clark County, where Las Vegas is, and Indian Springs. There's a little area there called Indian Springs, and there's a military base, and beyond that, next to that is Area 51 is all over there. So I'll let you know in our next, probably the video after this, what the results were with the licensed agent on the health insurance. And so but please, if you're in the position that I am, where you're having to make these decisions, and these are important decisions to make right when you're turning 65, because certainly these supplement plans, the one that I'm buying, there's a one-time opportunity to get in there and get it, no questions asked, no what they call underwriting, where they can, you know, start inquiring about pre-existing conditions and your history, and they can decline you or quote a higher rate if you try to do this later. So you want to do it right when you get it, so you get you're guaranteed to get the supplement plan. And that's one of the main reasons I'm doing it. It's not something that you can put off with no risk. So anyway, hope you enjoyed the video, and I will see you. Actually, you know what I need to do? I need to stop it, turn it around to see my face. Hang on. So anyway, as promised, I turned it around so you can see my face. So when I thank you, I like to do it so you can see me and hear me. Thank you for watching my videos. I appreciate it. Take care, and I will see you on the next one.